So welcome everybody to another edition of the MedTech20. We're very excited today to be joined by Bernhard Gilbey. Bernhard is the Chief Executive Officer of a business called 11 Health, and he's going to share a little bit about the story of how 11 Health came to be. It's a really unique and interesting story with the original founder of the business, Michael Sayers, actually being a patient in need of a medical bag or ostomy solution. And through that experience, he discovered that there was a real lack of support for patients requiring ostomy solutions. And he went on to then use his own ambition and drive to actually build a solution that is now helping a lot of patients. And it's a really exciting and, like I said, a quite unique story. So Bern is going to share a little bit about that with us. He's also going to talk about what the future of 11 Health looks like. He's going to talk a little bit about connected devices and digital capabilities in the medical device space as well. So it's going to be a really interesting conversation. I hope you enjoy it. And without further ado, let's dive into it right now. So, Bern, welcome to the MedTech 20. Really excited to have a really interesting conversation with you. I know a lot of the audience will probably not be super aware of the business, so looking forward to kind of getting into some of those things. But first off, just welcome to the show.
Thank you. Thank you very much, Gordon. Really appreciate the invitation and the chance to talk to you a little bit about 11 Health and what we do.
So I guess, one of the first questions, if we kind of go a little bit into the history of how 11 Health came to be, the discussions that we've had, it's been a really interesting story so far, one that's fairly unique, full of positivity and optimism. There obviously is an unfortunate side to it as well, a bit of an element of tragedy with the recent passing of the former chief executive and founder of the business, Michael Sayers. So I'm wondering if we can start with you outlining a little bit about the history and maybe talk a little bit about what Michael's original vision for the business was as well.
Sure. So a bit about Michael. Michael grew up in northwest London, but from the age of about 12, he'd suffered from Crohn's disease. And obviously, Crohn's is a bowel disease, and over the next several decades, he had a series of surgeries to try and help cope with that condition. Unfortunately, around 2009, he ended up with intestinal failure and found himself on external nutrition. In 2011, he was finally matched with a bowel donor, and he went off literally in the middle of the night to have a new bowel put in. The surgery went well. It's obviously a long road to recovery, but Michael did great, recovered from the surgery really well over a period of time with the bumps in the road that go with this. And he was the 11th patient in the UK to have this kind of procedure. And that was where the name 11 Health was born. Now, while he was recovering from surgery, he was connected to an ostomy bag. And he, like almost everybody who has a procedure that results in the creation of a stoma, found himself living with an ostomy bag, but not knowing when the bag was full until, unfortunately and somewhat unpleasantly, a few minutes too late. And then, there's obviously a bit of a problem to try and tidy up. And it occurred to him that there must be something that you can do to help ostomates understand when it's time to empty a bag. So from his hospital bed, and then subsequently during his recovery at home, he hacked together a sensor. And the idea of the sensor was that you could clip it onto a bag and that it would tell you when your bag was full. It would send you an alert to your mobile phone or your iPad, and tell you when your bag needed emptying. He raised some money in 2013 and created a proper business out of it. Used that money to develop the sensor, take it through a few design iterations, bring it to market, and then in 2016, he was in a position to raise some more money off the back of the original sensor, and a lot of that money came from investors in the US. He was encouraged to bring a lot of the business over to the US, particularly in Southern California, where there's a really strong medtech community. And as you've seen in places like Silicon Valley, having a strong community of people actually helps you build a business like this. So he brought the technology and the business over to the US, and using the money that he raised in 2016, he then took the designs of a sensor that would clip onto the bag and started again putting sensors within the bags themselves. There were obviously a number of additional things that he could establish through having sensor technology built into the wearables. And that R&D process culminated in 2018, when for the first time ever, wearables with inbuilt sensor technology were released out to patients to collect information on fluid balance, on output levels, on things like the skin temperature around the stoma, that are all indicative of problems arising or helpful in managing the condition. And here we are in 2020, having released another set of wearables that, again, Michael was the inspiration behind, using the learnings from that first generation to release, a really strong set of wearables a little earlier this year. As you said, Gordon, what started as a story of excitement, and from a patient's perspective, he built the solution that 11 Health is all about. Very sadly, he took ill in March of this year. And Michael's health journey had always had its bumps along the way, but for most of us, and I had the pleasure of knowing Michael over many years, he actually seemed unbeatable. Unfortunately, in March of this year, he became ill again, only this time very, very sadly. This time it got the better of him, and he passed away at the end of May. But leaving behind a vision of a patient-led company, of a company that believes that its purpose in life is to help patients, one patient at a time, understand their condition, help improve their own outcomes with better education, with using technology to support that, and helping them look after themselves so that it's their perspective that's brought to their healthcare that makes sure that from a patient point of view, they've got the technology and the support that they need to recover quickly and effectively.
It's a really inspiring story ultimately, and it'll be fascinating to see how the vision of the company continues. A lot of the videos on YouTube that you can watch from the 11 Health site with the patients and talking about how much it's changed their lives. I mean, it's a real game changer.
Yeah, we actually had a convention last year where we brought together our patient coaches and patients, and had the most remarkable 2 days where people shared their stories and shared what they had gained from 11 Health, either as patients or as patients who support other patients on our peer coaching platform. It was an extraordinary couple of days, bringing together, I think, everything that 11 Health is all about, our patient-led, patient-delivered support and care for people who've had a stoma.
Thanks for that, Bern. And you do hear a lot of stories. You touched on this. You hear a lot of stories from patients who require this kind of treatment, who really do feel like they've been left to kind of fend for themselves after surgery. And so, I think the uniqueness of this model that you're bringing to the market, centering around addressing the patient and the issues that they can go through. I just think it's the perfect timing for it. So I wondered if you could maybe walk us through a little bit about how you build that support community through things like the patient coach and the Alfred Smart Care app.
Sure. We see 11 Health as the combination really of three things. The first one is the integration of technology into wearables, and that enables really for the first time the collection of data from around the stoma area and from what's coming out of the stoma to provide really valuable data. We've then developed the ability to take that raw data and convert that into usable information so that you can not just detect what's happening, but also create some actionable insights. What can you do with the information that you've collected? And the other thing that we've found really important is to provide human support for the use of that information in helping patients understand what and how and when they should change what they're doing, look after certain areas, and develop things. And what better a group of people to help you do that than somebody who's walked in your shoes? So what we have developed is a peer-to-peer coaching platform. All of our patient coaches are themselves ostomates. Most of them still have their stoma, and they are certified health coaches, but also obviously specialists in the world of living with a stoma and how to manage the condition. So when you put that kind of support, which enables patients to ask questions around how do you learn to live with a stoma, how do you get used to managing your stoma when you go out, and the sort of social questions that I think are not always easy to find answers to, with that information that our technology delivers about what's happening with your body, that begins to show you where there are potential problems coming over the horizon. Put those things together, and what you have is a really well-informed, well-educated patient who can much more quickly not only look after themselves, but identify problems, deal with any complications early on, and improve the patient outcomes, improve their quality of life, improve their understanding of their condition, improve the way that they recover from the procedure and get back into the normality of life, using the patient coaches who've been there and done it before, using the information that our wearables offer them and bringing those together in a way that means patients have that deeper understanding of how to help themselves.
So it's quite interesting and maybe even a little bit surprising that this kind of device hasn't been on the market sooner. And maybe it's because the sector itself has kind of always seen medical bags as more of a commodity product. But why do you think the sector has not kind of adapted more of a digital solution up until this point?
Yeah, that's a great question, Gordon. And I think that for the most part, we go back to where we started and Michael. And I think that one of the reasons why it's taken so long for this kind of solution to be available is because the world was missing such an inspirational individual as Michael. Michael lived with medical bags over 30 plus years. And it was that understanding, that ability to see what those problems look like and find the answer, have the motivation to find the answer, that I think has provided the energy and the direction for a business like 11 Health to be created. So I think that firstly, technology becomes more sophisticated, and that's enabled us to embed technology at very small levels within the wearables themselves so that they can be manageable and be worn by patients. But actually, I think the reality of this is that it took a patient's vision, a patient's hunger and desire to find a solution for patients who have a stoma, who live with an ostomy, to be able to find the solution and have the grit and determination to take a business from just a thought process to something that it is today, delivering solutions for patients and delivering better patient outcomes. And perhaps the world is often changed by the vision and inspiration of an individual or a small number of people, and I think Michael was probably just that person.
Yeah, I mean, it's not that often that you hear these kind of stories in kind of the medical context. To have a patient first design this and then be able to affect the lives of so many other patients, that really is an inspiration.
Yeah, definitely.
So, Bern, you joined 11 Health as originally as the chief commercial officer. Obviously, following Michael's passing, the board asked you to take on the responsibility of CEO in his place, and I'm sure that's presented some interesting challenges and opportunities. But would love to hear a little bit about what it's been like for you, and what are some of those challenges and opportunities for the business.
Yeah, another great question, Gordon. Look, I think for the Brits watching this video, this is a little bit like following Alex Ferguson at Manchester United. Michael was uniquely inspirational and um, had a magnetic personality and built a business that was in very large measure successful because of who Michael was, the connections that he made, and that ability to open doors and inspire people. And being asked to take over the responsibilities when Michael passed away was one of the most humbling things to be asked to do. I think for me, it's given me the opportunity to try and deliver on Michael's vision, build on the platform that he created, and bring some of my skills to the business, some of the things that I've done in the past, and inevitably perhaps adjust some of the ways that we might go about things which reflect my background and my experiences. Michael left us a great platform. He really did. We just started a fundraising set of discussions when Michael passed away. So stepping into those shoes has obviously been quite a challenge, and those are obviously ongoing. That was something of a challenge, and obviously we were in the middle of a pandemic. So at the time that Michael passed away, we had an R&D team that were working remotely and not in the office, not being able to use the lab equipment, not being able to collaborate around the table. And so we had to work extremely hard to maintain productivity within the R&D team to keep them developing and working on our new generation of wearables. And of the things that I'm immensely proud of, if you just took the fact that that team successfully released that new generation of wearables right in the middle of a pandemic, I think that is a great testament to how well the business pulled together and allowed me to perform as a CEO and take the business on with the support of an incredible team, all of whom are probably one of the most motivated groups of people to deliver on the vision that Michael laid out for us. And so, I think that there are obviously challenges when you step into a business in circumstances like this, particularly when you have fundraising discussions going on, particularly in the middle of a pandemic, and you can't bring people together in the way that you would like to. But I guess, I have been in leadership and management positions really for most of my career. I think that has helped me guide the business over the last few months. But there's no doubt that the team that exists within 11 Health and the people that are motivated to deliver on the opportunity that we have has made the job significantly easier. They're an incredible team of people, and some of the smartest folks you're gonna find around, and they've been so unbelievably supportive and and I guess determined, to win whatever the circumstances. That to some extent I've been able to focus on the things that I need to look after, particularly around the fundraising, and those other people have made sure that the rest of the business succeeds while I get on with the things that are most important on my desk.
Yeah, I mean, it's all about surrounding yourself with the right people, all sharing the same vision, same motivation. So it sounds like you guys are in that position, which is really great. Bern, you came from a significant career practicing tax law before moving into the medical devices sector, and you mentioned that you had known Michael for quite some time. But really curious to hear a little bit about what appealed to you about the space back then, and then maybe a little bit about what really excites you about the sector today.
So I mentioned a few minutes ago I'd spent most of my career in one form of leadership or management or another, and it is obviously true to say that I was a practicing tax lawyer for many years, but it became clearer to me over time that the things that I really enjoyed were more the business of the business. And Michael and I had a long-standing friendship, but had also done some things in the past together. So we set up a charity bike ride some years ago that we ran 6 or 7 times. That was a sponsored bike ride from Paris to London, and that was done with a couple of other friends. And none of us had any experience in putting a charity bike ride together or doing long-term bike rides. And between the four of us, we managed to put on successfully over a number of years this bike ride from Paris to London. And I think we raised probably the best part of 600,000 or 700,000 pounds over the course of the years that we ran the bike ride, and it was very successful. But the thing that we learned was how well we worked together as a team. And so when Michael and I got into a discussion about where 11 Health was up to and what he was looking for, and how he was planning to grow the business, we had a conversation in which we started somewhat jokingly, actually, about, well, maybe I should join 11 Health. That would give me a chance to focus more on the things that I enjoy, and it would help Michael have a foil to talk things through with, somebody who could chat away about the best ways to do things or different ways to look at things, and help support the business. And the conversation sort of developed from there. I think that the medtech space is really interesting, and one of the reasons that Mike and I would spend as much time talking about 11 Health as talking about legal issues was because I think the space is really interesting. I think healthcare is one of those areas that will always be necessary. It's always going to grow. It's going to drive innovation. Whether healthcare systems can adopt innovation at the speed that they perhaps ought to is, of course, one of the challenges. But nonetheless, as a sector, its value is ever more important as we have aging populations, more people to look after, less money per head to do so. And so the need for technology and innovation and the need to drive improvements within the system are incredibly interesting areas to look at. And 11 Health is right in that space. We have developed our technology to enable patients to understand what's happening. We've developed technology that enables remote physiological monitoring, which is very important during times of a pandemic, as we prove. Remote care management of patients is obviously critical when you're trying to help patients avoid going into medical facilities. And 11 Health represented such a great example of where technology innovation could make a really big improvement to patients' lives. And so for me, when Michael said, look, do you want to do this more seriously? It was just an opportunity that I couldn't turn down, and I joined in May of 2018. I hung up my legal boots, so to say, and joined Michael as Chief Commercial Officer. And we started to do things together and build the business together. And Michael and I had such different backgrounds and experiences that the value for us was really in the complementary skills. I'd been in major professional service firms all my life. And so inevitably I brought experiences that come from that, but also from having worked with client companies at all different sizes and stages of development. So I was able to bring a lot of what I'd experienced over my practicing career, either as a leader or manager of my own teams, or that I'd observed in other companies or that I'd observed in our own firm, and to help make things more effective within 11 Health, and develop things internally. So it was a sector I was really interested in. Feel that it's a sector that if anybody is looking for a career opportunity where they can both make a difference and be part of something that is fast moving and exciting and has huge challenges. Healthcare is one of those sectors where if you get it right, the net result is patients get better, improving patient outcomes. And so the value of what you do, you don't just count in in pounds or dollars, but the improvements to the patients whose lives we positively impact is obviously one of those things that that is very hard to do in many other sectors. So it's a really exciting space, and I think will continue to be. And so I was attracted to it through discussions with Michael, and 11 Health as an opportunity was just the perfect opportunity.
Good. So thanks so much for sharing all that you have today, Bern. And one of the questions that I tend to ask my guests towards the end of the podcast as we kind of wrap things up is really about what they see as the future vision for the businesses that they operate. So I'd love to hear a little bit about some of the plans, whatever you're able to share with us today, in terms of new product development, partnerships, expansion. Just love to hear a little bit about what the future is going to look like for 11 Health.
I think that we benefit from having developed deep expertise in how to make technology improve patient outcomes, how to improve their lives. And so when we look at the opportunities that 11 Health has, there are so many that our challenge really is to pick the right ones to focus on at the right times. We are going to build out an increased product suite within the range that we have at the moment, focused within the ostomy community. And we obviously have tremendous opportunities. The US represents only, I think, 27% of the global market. And so we have this huge opportunity beyond the US, and our next steps are going to be in Europe. And then we'll look further afield from there. But the other areas that are incredibly interesting are in how we take the skill sets that we've developed and apply them in different areas of the market. And there are some really good opportunities to continue to develop our skills around sensor technology and the distribution of the information from those sensors in a usable fashion, mobile phones and through to iPads and dashboards. We are learning things about behaviors of a stoma that people have never had insight into before. And big data is a sadly overused phrase and isn't necessarily the most valuable. But we know the data we are collecting is incredibly interesting. It needs to be developed, and we've got work to do on it. But it represents for us another significant opportunity to create much more precise healthcare solutions based on the information that is available now about the patient and information more generally about patients that we're learning from what our sensor technology delivers. The aspirations that I always go back to Michael had for the business, which really was to change the lives of patients, to look at things through the lens of the patient, and to do it one patient at a time. And I think we believe that we will have, as an organization, we will have something of a major impact on healthcare generally, bringing the attributes to the healthcare ecosystem that Michael imbued within us, from the day he started the company.
Wonderful. Well, I mean, it's great work that you guys are doing at 11 Health. I wish you continued success. I know the patients are really loving what you've done so far, and I know that's going to continue. So thanks so much for joining us today on the MedTech20, Bern, and let's keep in contact.
Thanks, Gordon.